So what will happen if Democrats somehow get their way and we get a single-payer health care system? Let me bring in a fan of that system, Richard Fowler. He's a Fox News contributor and host of the Richard Fowler Show. All right, Richard, I will put the onus on you. Convince me that single-payer is the way to go.
I mean, I could try my hardest. I don't think I'm going to convince you, Kennedy. I think you're pretty strong in your position.
Yeah, well, it's a rational one.
Let's talk about the Senate bill first. I think the Senate bill gives you a little bit of insight of how close we are to moving to a single payer, right? So in the Senate bill, there's a provision that gives a $50 billion bailout to insurance companies because what the Senate has realized is that providing insurance in the post-Obamacare world is not profitable. And here's why. Because when the Affordable Care started, the Affordable Care Act was put in place, the ideal behind it was we would force insurers to insure people they don't want to insure instead of moving to a single payer right off the bat. And what insurance companies saying is
which would force taxpayers to insure people they don't want to insure by having the government steal their money. Go ahead.
No, well, let's talk about that point. So no matter what happens in the system prior to the Affordable Care Act, if you didn't have health insurance and you went to the emergency room, which is the most expensive health care you can get, we were already paying for that, right? Because if a poor person went to the emergency room, all of our prices went up to pay for he or she not being able to pay.
That's also a bit of a misnomer because that assumes that the only health care that low-income people were receiving in this country was through emergency rooms. That, of course, is a last resort for people like the homeless, but of course there was Medicare and Medicaid and a series of clinics and institutions that were helping the less fortunate. But no one ever talks about that. Conveniently, they leave that out as though hundreds of millions of people were parading through emergency rooms at $1,500 a visit just to get their tonsils checked.
But I mean, here's the thing, though. What all the studies show, and the Kaiser Family Foundation talked about this prior to the Affordable Care Act, is yes, you're right. Millions of people weren't showing up to emergency rooms, but people who didn't have health insurance were like, I'm not going to go to the doctor. I'm not going to get preventative care.
People still do that even when they've got insurance, Richard.
But they're more likely. And actuarians could point to this, they're more likely than not to go get a checkup now that they actually have insurance to do it. And I've said this on your show before, Kennedy, and I'll say it again. Just because you have health insurance doesn't mean you have adequate health care. And I think that's the debate. And what Democrats are saying, like Elizabeth Warren and Bernie Sanders, is the best way to ensure that we as a country have adequate health care, not health insurance, health care, is going to require that the government say, hey, listen, it is the right of the government to make sure that every American has the ability to life, liberty, and the pursuit of happiness.
I want to stop you right there
if you're not healthy.
The word adequate to me in this context is so incredibly offensive. I don't want my health care in this country to be adequate. I want my health care in this country to be extraordinary. And the only way that can happen is if you have innovation, and if you have a free market, and if you have companies and doctors competing. And I know that's a dirty concept to statists who want to control every aspect of our lives. But when you move to a one-size-fits-all, ordinary, adequate program, that's when people die. In fact, according to the Daily Mail, listen to this, the Daily Telegraph, British patients and the NHS system have a 45% more likely chance of dying than patients in the U.S. who are fortunate enough to be subjected to the dying remnants of a free market system.
Well, a couple points on that, Kennedy. Point number one is I think in the system, I think people forget that before the Affordable Care Act, the healthcare system was the wild, wild west. A young woman who might have been
Unfortunately, it wasn't.
It really was, though. I mean,
it was not. It was based on the entire healthcare system, and medical conglomerates were based on Medicare in this country.
But wait, think about the child.
From billing to care access.
Well, wait, think about the family who had a maximum cap on their health insurance and had a prenatal child, right? And that prenatal child, if they had a maximum cap of $1 million, the care for that child could have been $750,000, meaning that family, for the entirety of that policy, only had an additional $250,000 to spend on the entire family's health care. That's what health insurance companies were doing if they were covering individuals who had pre-existing conditions to begin with.
Let's say the ACA fixed that one problem, and that of course is no small problem when you have a child who is born with some sort of congenital defects that require a lifetime of care. That is the worst case scenario, and that is awful. But let's say the ACA fixed that. It created so many more problems that have compounded since its inception that health care in this country is dying. And too much government in our healthcare system has sickened it to the point where it is an ICU.
I beg to differ. I think health insurance companies are dying, but healthcare isn't dying. Let's just take a look at some systemic diseases that we have in the United States. Let's take HIV/AIDS, for example. The HIV/AIDS rate since the Affordable Care Act has actually gone down, right? Because people are getting tested.
Thanks to the private sector.
Right, but the private, that's my point. The private sector is not subdued because we put onus on insurance companies to actually really cover their patients,
yes, it is.
Which they weren't doing before.
By definition, the private sector is subdued. And here's my final point, Richard, and this is a really important one. If you want the best minds to be attracted to medicine, you can't have a medical system that is adequate. And that's what will happen if we have single payer in this country. Last word, you have 10 seconds.
Well, I think that's a false pretense, right? Think about a country like Cuba, who's very poor, communist country, but they actually have superb health care, right? They actually have a cure for lung cancer in Cuba that we don't have over here. So that is, quote-unquote, socialized medicine at its farthest extreme.
Political dissidents in prison.
That's very fair. I'm talking about the healthcare system. Let's not mix apples and oranges here. So what you see in a lot of what you see in a lot of socialized medical systems, right, is a lower infant mortality rate. You see innovation all the same. In Spain, a socialized system, they're close to getting a cure for HIV/AIDS.
How can you have innovation if you don't even have the internet, Richard? I'm
telling you that innovation is happening. They have a cure for lung cancer and we don't here in the United States. How do you answer that?
Richard Fowler, thank you very much for your time. You know I adore you.
Kennedy.
Thank you very much.